that the Prime Minister caused in British Columbia when he legalized hard drugs. In fact, the Public Health Director of Montreal has suggested moving forward with that same legalization. Will the Prime Minister reverse course on his radical position when it comes to legalizing drugs? Or will he impose the same chaos in Montreal that he already imposed in British Columbia? The Right Honourable Prime Minister. Mr. Speaker, let's take a moment here to reflect on what occurred yesterday. You had to censor the Leader of the Opposition because he refused to withdraw his unparliamentary language. He was engaging in political attacks about a huge human tragedy in British Columbia. Now, we, of course, take this tragedy seriously. We act with compassion. We act based on facts and evidence. We will support British Columbia as they transition and adjust their pilot project. The Honourable Leader of the Opposition. So, does he rule out legalizing hard drugs in Montreal? Yes or no? The Right Honourable Prime Minister. Mr. Speaker, the Leader of the Opposition knows full well that our government acts based on facts and teamwork with provinces. The province of British Columbia requested a pilot project. We're working with them. We studied it with them. We gave them the green light for their pilot project. We have not received such a request from any other provinces. If other provinces wanted to have a similar project, we would look at it and make a responsible decision based on the facts and based on precedent in other places. Right. So he is opening the door to legalizing hard drugs in Montreal and perhaps in other cities in Quebec. We're against it.
The Prime Minister legalized smoking meth in hospital rooms, shooting up heroin in parks next to children, using hard drugs on public transit. The British Columbia government has asked him to reverse this legalization for parks, hospitals, and transit. Will he? Yes or no?
The Right Honourable Prime Minister.
Mr. Speaker, the opioid epidemic is hitting families, communities, and individuals right across this country and has for many, many years. That's why we are continuing to use an approach grounded in compassion, in public safety and public health, and facts-based decisions. We responded to British Columbia government's asking for a pilot project. We will, yes, work with them to adjust it in ways that they see fit. It's important to make sure that BC continues to do the things that it needs to do to keep people safe in its jurisdiction.
The Honourable Leader of the Opposition.
He still refuses to answer the question on whether or not he will reverse himself. He made the decision to exempt hard drugs from the criminal law so that it became legal to smoke meth or crack in a hospital room, including around nurses who are breastfeeding their kids. This has caused chaos, and 6 British Columbians are dying every day that he delays. So will he announce that as of today, he's changed his mind and he's reversing his legalization of hard drugs in BC? Yes or no?
The Right Honourable Prime Minister.
Mr. Speaker, a number of years ago, British Columbia approached us with a pilot project that they wanted to bring in to look at a different way of dealing with the ongoing public health crisis that was hitting British Columbia around the opioid epidemic. We worked with them as they developed this pilot project, and now that they are asking for modifications to that project, we are looking at those modifications, and we will work with BC as they seek to adjust their plans around public health and around dealing with this opioid epidemic.
The Honourable Leader of the Opposition.
Speaker, there is no time to waste. The BC government asked him to reverse his legalization of crack, heroin, and other hard drugs in public places on Friday. Every day, 6 British Columbians die of overdoses under this policy, and many more die as a result of drug-induced crimes. So there is no time for bureaucratic and political considerations, will he announce now that his experiment with legalizing hard drugs in BC is over? Yes or no?
The Right Honourable Prime Minister.
Mr. Speaker, you will understand if I take it with a little skepticism when the Leader of the Opposition says this is not about politics, because he has been the one that has been pointing out vulnerable people and trying to pursue ideological aims on this ongoing public health crisis. We have consistently stepped up to work with provinces, with municipalities, with jurisdictions, indeed, including by moving forward with British Columbia as they wanted to try a pilot project, that we are working with them to adjust in ways that make sense. We understand the urgency and we will act.